What is really exciting about modern spinal health care is the great advances that have really happened over the past decade, especially even over the past 5 years. When you think of old spinal treatments, everybody gets scared and they're afraid they're not going to get better. But with the modern care, we get everybody back to their life. The interesting thing is when you look at the robotic surgery, the stem cell therapies, minimally invasive procedures, people are getting better faster, spending less time in the hospital, and getting back to their lives. And that's what's important. But of all these great advances, the one that excites me the most are the disc replacements in the neck. When we take a look at cervical artificial discs or cervical arthroplasty, this is a way for us to treat severe neck and arm problems without having to fuse the neck. We put it in a device that preserves the motion at the affected level rather than putting a bone graft in and making it rigid. This means more motion through the affected levels, but also no stress on the adjacent levels. And with this, we see patients getting better faster and doing better short-term as well as long-term. And this is really exciting. It's extremely important to me because I've got bad neck problems. In fact, 4 years ago, I had surgery on my neck because of the problems I was having, and it was 2 disc replacements I had put in my neck. And I'm so excited because now, 4 years later, I'm back to being a surgeon. I'm an active father. I'm playing golf, playing tennis, playing football with my kids, doing so many things that in the old days would have been more of a problem. So I'm excited about these advances not only for myself, but for my patients, because they can get back to their lives just like I did.
For the few people who have a spinal problem that requires surgery, it can be very difficult to make the decision about which surgical option is right for them. It is always a balance between wanting to find the smallest procedure with the least pain and the fastest return to a normal life, and making sure you have the procedure that actually is doing enough to fix your problems. For patients who have a relatively straightforward spine issue, a microsurgery or a minimally invasive technique usually is the right option. And for these patients, most can expect to get back to a normal life very quickly. Unfortunately, there are some spinal problems that are more complex, and these surgical techniques are not effective. The most common mistake I see patients and doctors making is trying to use a little surgery to fix a big problem. The desire to do something small and quick can actually lead people to make the wrong choice and to jeopardize their recovery. It can make it even more difficult to get the problem fixed during a second surgery. For people whose spines have instability or scoliosis or spinal curvatures, you have to match the surgery you're doing to the problem the patient has. It can be hard to come to grips with the fact that you may need a bigger surgery or a slower recovery is needed, but for some patients, that is the path that will work the best for them. With spine surgery, it is critical to get it right the first time.